Good evening and welcome to this second of our daily updates from Zimbabwe and around the world on coronavirus. My name is Robert Mukondiwa. This program, Diplomatic Passport, is not on lockdown or shutdown because we know the more a nation is shut down, the more information they want to know. My Diplomatic Passport will take you everywhere you seek answers from so that you don't have to travel there. We shall be traveling beyond the headlines to make sense of the coronavirus story and its impact on the nation and the globe at large, so that you are privy to the flawless facts. We separate the facts from the fake news and speculation. We also celebrate our heroes and heroines both on the front lines and in the trenches, as well as our salient unsung heroes. Yesterday, we celebrated the life of broadcaster Zororo Makamba, who died of coronavirus-related complications. He was the son of business mogul James Makamba. And yet in that whole tale, a stifled majority was not mentioned: women on the front line. Zororo had a mother, and in all this darkness, the women who usually shoulder all the messes that men create are hardly given recognition. We celebrate Zororo's mother, Irene Makamba. All those great attributes that we were celebrating yesterday are owing to the nurturing genius of her hand. So to all the women out there, in this our darkest hour and our deepest despair, we take a moment to say thank you. Without womenfolk, our mothers, our planet would never have known peace after conflict or healing after bruising. A warm thanks to our viewer Mandi Maodzwa for alerting us to this painful lack of appreciation of our women in this present crisis that we face. Today we shall be getting updates from the United Kingdom and the United States, from our men and women on the ground. With sizable populations of Zimbabweans in that part of the diaspora, we want to know how they're coping. Their anxiety as they worry after us here must also have taken its toll already. We shall also be interrogating the psychological effect of this crisis on the general population. Yet the object is prevention and safety to reduce the spread of coronavirus. Speaking of ways to reduce the spread and contraction of COVID-19, today our viewer Diana Mavunduse implored us to address the issue of using face masks. Now, a lot of people, I'm sure you've seen, walking around with face masks, and we actually want to know what happens with them. We've been told that if they're not used properly, they can actually be a source of infection. One should know which masks are recommended, and most importantly, how to safely dispose of these masks and how long they're effective. Masks are only effective when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. According to the World Health Organization, if you do not have any of the outlined symptoms associated with coronavirus, like a fever, dry cough, or a runny nose, you do not need to wear a medical mask. The World Health Organization also released an informative package that deals with the subject.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough. Why? Because healthcare workers and caretakers are in close contact with ill individuals, so they're at higher risk of catching COVID-19. And sick people should wear masks to protect others from small droplets that can come out when they cough or sneeze. So, for healthcare workers, caretakers, or individuals who have fever and cough, this is how you should wear a mask. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Verify which side is the top. This is where the metal piece is. Then identify the inside of the mask, which is usually the white side. Then fit the mask on your face. Pinch the metal strip or stiff edge so it holds to the shape of your nose. Adjust the mask over your face, covering your mouth and chin, making sure there are no gaps between your face and the mask. Do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard the mask immediately in a closed bin and clean your hands. It is important not to reuse the mask. Replace it with a new one as soon as it gets damp. And remember, the best way to protect yourself from the new coronavirus is frequently cleaning your hands with alcohol-based hand rub or soap and water. Stay safe and see you next time.
An informative piece there explaining various facets to the face mask. Interestingly, last night in the city centre, I witnessed street kids wearing face masks. They had been discarded in city bins and they were posing a danger to the street kids while they actually thought they were being protected. So make sure you play safe and responsible when you're disposing of your mask. Now, before we continue, we've got a flurry of activity, and Jay Mashandudze is asking a very important question. Why is he wearing gloves? Now, you will know that we've got a studio that had been a flurry of activity over the past couple of months, and we are still in the process of making sure that it is disinfected, and we should at least have finished that by tomorrow. So I need a table, I need to touch the door, but I need to stay safe. That is the reason why I am wearing these gloves. And of course, we are happy to find that budding Melissa is watching from the Netherlands, as well as Anna de Souza, who's watching us from Lisbon, Portugal. And indeed, there is a lot of activity in Europe, which at the moment is still the epicenter on the planet. Now to the international community, where one of the most neglected issues around any crisis is the mental impact on a society. I'm now joined on Skype live from Birmingham, United Kingdom, by Carol Nyakujuga, a managing director at Lorok Healthcare and Equipment and a mental health professional. Carol, welcome to the program and glad you could join us. Now, first, as a medical professional in the area of mental health, what psychological effects has the COVID-19 pandemic had on populations in your view?
Okay, Rob, this has absolutely been an unprecedented time in different nations here in the United Kingdom and, of course, globally, right across the world. And, you know, with a lot of behavioral change, modification, the major isolation, the that comes with this whole isolation policy, and then of course increased levels of anxiety, where people are panic buying food, where people just, that sense of uncertainty, just not knowing what's going to be happening tomorrow, and of course routines being disrupted, children leaving school, and of course, you know, sort of people that were used to social gatherings, just that not happening. That human contact has really can lead to a lot of depression, a lot of isolation, and of course psychological conditions such as anxiety. And those people that had pre-existing mental health conditions, you will see a definite rise in symptoms and presentations at this point.
Beautiful. But also, as a mental health practitioner, what do you recommend should be done in dealing with the stress that comes with the quarantining? Because it's very stressful, isn't it?
It's really a challenging time. It's unprecedented in the way that things are at the moment. But the main things that people need to be able to do is to have that sense of belonging, that sense of familiarity. So as much as possible is maintaining a routine of sort in your home, you know, sort of not omitting things like, you know, your daily living skills, your things. Waking up, having a shower, just bathing, just making sure that while you're in your home, talking to people that are in your family. If you live by yourself, having that virtual contact, you know, using your social media to be able to keep in contact with other people, but making sure that, you know, you utilize here in the United Kingdom, you are allowed to have one exercise a day. So, you know, use that opportunity to go out and have at least one exercise. In Africa, it's also looking at, you know, sort of solutions in Zimbabwe. Think about ways in which you can, you know, begin to, you know, kugadzirira chikafu, kugadzirira kuti, you know, if things go wrong in the next 3 months, that you can control. Outside, like, you know, looking at governments or whatever that you cannot control.
Well, there's something called phubbing, where people phone snubbing and not communicating, not talking to each other because of the internet. Now it's funny that the internet is bringing us together in this very dark time of quarantine. But moving on, I understand you're a director at a healthcare organization in the United Kingdom. What role has your organization been playing in the fight against COVID-19, and have you personally been called to service?
Yes, everybody, you'll find that everybody that has been working as a key worker, there are certain professions that have been identified as key worker groups here in the United Kingdom. I happen to fall professionally under one of those as a key worker, and a lot of my family and friends and people in my community also fall under that. In the company that I run and in my organization, we are definitely a key worker sector, and so people have continued to go to work, and of course then there's that increased anxiety amongst our employees, people. We've our recruitment processes where possible. We've looked at alternative ways of changing rotas, supporting our staff, and ensuring that.
Well, we're having a bit of a fudge there with the connection, but I'll push my luck and push the envelope here and ask another question that from what you're experiencing that side in terms of how coronavirus is being managed, what advice can you give to Zimbabwean health authorities and the general public about our present crisis as well?
Definitely on my heart, to be honest with you, Robert, and it breaks my heart to be in that situation where we know that our health system could be better. In nations like where I am, I've been in the health service for near enough 20 years plus, and we have a service is struggling under the pressure of coronavirus. In Zimbabwe, the fact that our health system is really, really thin on the ground, then you want to make becoming victims of this disease. I think there's a lot of denial in go to churches. I do understand the anxiety yekuti vanhu vanenge vachiti tikarega kuenda kumabasa tinodyei, which is true, and I've seen some statements of people saying, kusiri kufa ndekupi, COVID-19 so discouraged. And when it comes, it is a proper killer. So people just be conscious. Where you can access water, please wash your hands. Where you can stay at least 2 feet away from somebody, please stay 2 feet away from that. You are being yourself, and if you've got family who are in the diaspora who can help, then open up to those people so that they can be able to support as much as possible.
Oh, Carol Nyakuja, they're giving us a picture. Thank you so much, Carol, for joining us, giving us that picture of mental health preparedness from the United Kingdom. And now to the United States, which is also expected to become the next epicenter of the virus, with the New York mayor, Bill de Blasio, warning other states to get ready for an avalanche of fresh infections because nobody's safe. We've got our man on the ground there in the United States, Joseph Mahia, in Morgantown, West Virginia, and he gives us details of the reality of that emergency that side of the pond.
My name is Joseph Mahia. I'm the co-founder of Fresh Inc. I'm here in West Virginia. I'm studying at West Virginia University doing computer science, but right now my school has been shut down and we're supposed to take online classes for the rest of the semester. And we cannot actually leave the state or leave the country, so we're just stuck here in Morgantown. Just like many of the people that I know in other states. The only things that are open are pharmacies and supermarkets. You can find pretty much anything except maybe toilet paper, bread, eggs, and meat. Those are the most on-demand things that people are looking for.
Well, that was Joseph Mahia there with those images of eerie, deserted streets and shops in the United States. Now, before we go on to the next little bit there back in the United Kingdom, and just to read a few of your remarks, Budding Melissa says, we are updating you too from Europe. Stay in touch and we're going to be updating you as well. Jay Mashandudze has just gotten our response and says, thanks. Remember to dispose of them correctly and wash your hands. We've got Mutakiwa Precious watching from Durban, Malvin Nyangara in Cape Town, and Sam Dondo. We also have a quick response here. Hope the home remedies won't make people complacent. Coronavirus is a notifiable disease. Once you get symptoms, go straight to the nearest healthcare center or make those calls. Now back to Muddy Island, the United Kingdom, where they are also battling with the crisis. And Zimbabwean journalist Melody Gwenyambira is there for us and filed this quick report.
Corona is a word that we're getting used to, and as a citizen of the human world, I have seen the negative effects that the disease leaves in its trail. As Zimbabweans, we cannot dispute it because it is a pandemic. The human race is at war, not with each other, but with this virus. It lives on surfaces, it transfers easily. It's killing the old, it's killing the young, it's killing those with underlying conditions, and it's killing those that are considered the healthiest. Where I am, we're in lockdown. Everything is shut. All the airports are closed. Nothing is flying in, nothing is flying out. So we're basically at home, staying indoors. Only the key workers are going to work. Only the supermarkets are open, but you cannot go to the supermarket every day. You can only go once or twice a week. But we are safe right now. We're in the house and we don't have corona. We're just trying to stay safe and stay alive. That's the most important thing right now. So I encourage everyone to wash their hands, practice good hygiene. Each time you go outside, please practice social distancing and make sure you're wearing your gloves and an approved mask. Take care of yourself because this disease is dangerous and it's really bad. So we need to take care of ourselves and take care of each other.
Take care of ourselves and take care of each other. That was Melody Gwenyambira. They're those who know her, seasoned Zimbabwean journalist who's usually gaga and evergreen. But if you see her this serious, it just shows you the depth of this current crisis. And of course, Melody's also currently watching with us live from her base in Birmingham in the United Kingdom. Tomorrow, we continue to satisfy your need for more information, going in depth with local statistics and figures, including updates on what to do to stay safe and what the hotspots in Zimbabwe are. We shall also be giving you exclusive images from inside the warehouse housing that material that billionaire businessman Jack Ma gifted to Zimbabwe. Now, earlier on in the day, Victor Nyamandi, the Director of Environmental Health Services in the Ministry of Health, assured me that none of the equipment had been taken out or stolen or sold as per social media reports. We had an interview with him earlier and I took him to task with regards to that because we asked the questions that you want to ask because you've got a diplomatic passport. Thanks to me, I will go everywhere you want me to go. I will ask every question you want me to ask. To make sure that we're safe as a nation, as a people, and so that we get out of this alive and look back and say we prospered together. Tomorrow we also unpack the painful, harrowing story, that reality of what happens to a person in their last hours as they die at the hands of this terrible disease. How do you die of coronavirus? How does it kick in? How does it kill you? How does it shut down your systems? We also unpack the funeral processes as well as other cultural processes that have been altered by this horrible disease. We no longer have funeral wakes, for example. We just have burials straight from the morgue, straight from the coroner, straight into the grave. That's not something that we're used to, but this is existence in a time of corona. We'll talk social also with regards to love. People, by their very nature, want to touch, want to kiss, want to hug. We are very touchy-feely creatures by nature, but what it is love in the age of corona. Keep posting your questions to Robert Mukondiwa at ztn.co.zw, as well as on my Twitter handle at ZimRobbie. And my diplomatic license today has been stamped. My diplomatic passport has been stamped for the day, and new information destination waits for us tomorrow where I will take you. My name is Robert Mukondiwa. Have a great day, have a great evening, and stay safe. Good night.